Wendy. I have not seen you since high school. How have you been?
Hello, Jim. I am doing great. How about you?
Very well, thanks. So, what have you been doing?
Well, I am married now. And we have a little boy. Plus, I became a nurse.
A nurse. Isn't that sweet?
Yes, sweet like the rapper Eminem. Nursing is an intense and demanding health profession.
But I thought you were going to college. Nurses train for like 6 weeks, right?
Yes, like 6 weeks in the sense that 6 weeks and 4 years are both specific amounts of time. I have a Bachelor of Science degree in nursing. We need to know a lot to save lives.
I'm sorry. Did you say, they make sure you know not to wave knives?
We use our holistic practice model so we can save lives.
Ah. You practice modeling, so you make good wives.
No. We monitor patients closely and we intervene with advanced skills and technology.
Oh. Like when a surgeon tells you to change the music playing in the OR?
Like when I persuaded the surgeon not to cut off the wrong leg. The way I did it, the surgeon thought it was her idea. That way she did not have a tantrum and botch the surgery. Or like when I diagnosed a patient with Lyme disease after he had been tortured for years by 6 different specialists with tests and treatments for obscure problems he did not have. Or the time I resuscitated a patient on an airplane by myself because the physicians on the flight were too afraid of getting sued.
Wow. It sounds like you should have been a doctor. Not being one must be a drag.
Yes, I weep, often, but I try to comfort myself with the thought of reincarnation.
Well, doctors do call the shots and tell you what to do. You are just their helper.
Actually, at my hospital, physician colleagues help me bring patients back to health with their useful knowledge and skills. Many physicians do great work, and some are my friends. But nurses report to senior nurses in a separate chain of command. Nurses do not report to physicians.
Well, did you at least get to marry a doctor?
I am married to a nurse.
I'm sorry. I did not know that you were a lesbian.
I am not. My husband has a Y chromosome. Do you even know what that is?
So, you married a male nurse. I am so sad for you. In high school, you were dating a cool guy.
My husband has a doctorate. He teaches at Johns Hopkins and runs a health clinic for street kids. Last week he discovered a new star system, which he named for our son. Did I mention his co-founding the band Radiohead, or his work with Nelson Mandela and Desmond Tutu?
So, are you ready to have sex?
Yes, I have been old enough for many years.
No, I mean sex with me, right now. I am up for my sponge bath.
No, you imbecile. Do you know anything? Or did the prison warden take away all your reading material?
Well, you are a nurse, and nurses are sluts.
I don't mean to wake your brain while it is in such a deep sleep, but have you had anyone look at that little spot there on the side of your neck?
The little dark thing here? No, it's nothing.
It could be something. Like, I don't know, cancer?
Oh. I will see a doctor.
You might also see a nurse practitioner. They excel at diagnosis and treatment, but they are also good at helping you live in a healthy way, to prevent problems.
Nurse practitioner? You mean the girls at my doctor's office who fill in for him when he is too busy to see me?
I mean the autonomous professionals with graduate nursing degrees whose care is at least as effective as physician care according to decades of research.
The nurse practitioners are so cute in those white coats. Like they are playing doctor.
Okay then. What work do you do, Jim?
I work in corporate communications. We position clients for success by managing what the public thinks about them.
I should have guessed. Well, I have to be going now. It was great.
Wait. We should get together sometime.
Yes, let's do that. I work nights, but I am usually free for coffee for a few minutes at 4 a.m.
That is a little early.
I understand. Let's set something up for after I retire.